Did you know that medical bills consistently rank among the top 3 causes for individual bankruptcy? According to Fidelity's 2024 Retiree Health Care Cost Estimate Report, the average couple will incur around $330,000 in out-of-pocket health care costs during retirement. That projection is an estimate for the average couple, not the worst-case scenario, and that doesn't include the cost of long-term care. Unexpected health care costs during retirement represent a potentially catastrophic risk exposure, and you can't hold catastrophic risk because it could collapse your entire retirement plan. Hi, I'm Harry Starn, and welcome to another Starn Standard Practical Knowledge video. In this recording, you'll learn strategies that can help you manage out-of-pocket healthcare expenses that might occur during retirement. Creating a soft cap on medical expenses can insulate your retirement nest egg. The 6 strategies that I will discuss include contributing to a health savings account, identifying the right Medicare plan, supplementing Medicare with a Medigap plan, adding a Medicare prescription drug plan, planning for long-term care needs, and committing to preventative care. Okay, let's begin by examining the health savings account. The Health Savings Account, the HSA, is a tremendous vehicle to help pre-fund your future healthcare costs. It offers a triple tax benefit: the write-off of contributions subject to a cap, tax-deferred portfolio growth, and tax-free withdrawals for qualified expenses. Knowing that retirees will most certainly have some level of medical care need, the HSA effectively supplements the retirement income portfolio. Rather than using funds from your retirement account, you pay medical costs with funds from the HSA. In order to be eligible for opening an HSA and contributing to it, you need to enroll in a qualified, high-deductible health care plan. The health care insurance plan is deemed qualified when it complies with the IRS's minimum annual deductible and the maximum out-of-pocket expense for that calendar year. Your high-deductible plan is a complete insurance policy. Once you fulfill your out-of-pocket deductible, the insurance company funds the remaining amount, some of which is coinsurance. This plan requires a higher initial deductible compared to the traditional healthcare plan, such as an HMO or PPO. As mentioned, withdrawals are tax-free when used to pay for qualified medical expenses. The list of qualified expenses is quite extensive and covers nearly anything related to the care, diagnosis, and the prevention of a physical injury, long-term care, and mental illness. HSA withdrawals can be used to indemnify medical expenses incurred by the HSA owner, his or her spouse, and the dependents. Note that the qualified withdrawals are not restricted to medical expenses incurred in that plan year. For example, you might decide to pay for the procedure with some out-of-pocket payments and retain the medical payment receipts. The receipts could be used years later to substantiate the tax-free withdrawal. An HSA adds wonderful flexibility to your retirement income plan. Medicare. Medicare, our country's social health care program, is available to any U.S. citizen who is aged 65 or older, and legal residents who have been in this country for at least 5 years, and again, 65 years or older. Medicare Part A covers costs associated with the hospital room, including semi-private room and board, general nursing, and pharmaceuticals administered during that hospital stay. There's no monthly premium for workers and their spouse who are fully insured for Social Security. Part B covers the costs of the physician, the operating room, outpatient care at the doctor's office or a clinical lab, preventative services such as flu shots, ambulance services, medical supplies, medical equipment. Part B requires a monthly premium payment. While Medicare Parts A and B provide a solid program, you need to realize that there are cost-sharing arrangements and gaps in the coverage. The cost-sharing arrangements include deductibles, coinsurance, and benefit limits. For example, the maximum number of covered hospital or nursing home days. The gap includes lack of coverage for long-term care, prescription drugs, hearing aids, eyeglasses, dental care, podiatry services, and overseas travel, other than maybe a short stay in an emergency room. Rather than signing up for Parts A and B, the Medicare beneficiary could opt for Medicare Part C. This plan, also referred to as Medicare Advantage, is delivered through private insurance companies that contract with Medicare. Medicare Part C must provide all the benefits received under Parts A and B and offer additional benefits, quite often including prescription drugs, vision, dental, hearing, and wellness programs. Besides the extra benefits, Part C typically caps the maximum out-of-pocket expense limit. The downside is that you need to use the facility or that network providing the policy. So, what Medicare plan is right for you? You need to consider several factors, including medical coverage needs. What are the coverage services? What doctors are in the network? What are the premiums and out-of-pocket cost sharing arrangements? Your risk tolerance and travel plans during retirement. For example, if you intend to travel extensively, perhaps to see your children, grandchildren, then you're going to need to lean towards Medicare Parts A and B. If you need frequent care and prioritize the capping of out-of-pocket expenses, then Medicare Part C might be the best choice. Medicare supplemental insurance, most commonly referred to as a Medigap insurance policy, is supplemental to Medicare. It enables Medicare recipients to close many of the gaps found within Parts A and B. The table shown here reveals Medigap plan choices with their corresponding coverages. Notice that the availability of alternatives allows you to select a plan that best accommodates your objectives and your cost constraints. The coverage eliminates certain deductibles and coinsurance payments, extends the number of days in the hospital, number of days nursing facility, even provides partial coverage when traveling overseas. You should carefully consider purchasing Medigap to help contain potential out-of-pocket medical costs. In fact, I remember attending a workshop on Medicare during a national convention on retirement. During the presentation, the speaker highlighted this supplemental insurance. Following the presentation, I went up front, stood in line, and eventually asked the speaker, "Can you think of a circumstance in which you would not recommend that your client sign up for Medigap?" She paused for just a couple seconds and then responded, "No, I recommend it every time." Note that you have guaranteed enrollment in Medigap when you select this coverage within 6 months of signing up for Medicare Part B. If you enroll at a later time, then the coverage is not guaranteed. Rather, you'll need to go through medical underwriting assessment. Medicare Part D is our country's social prescription drug plan. Part D is offered through approved private healthcare providers and available to Medicare beneficiaries who are enrolled in Medicare A and B. In order to obtain the coverage, you will need to self-enroll, and you'll do that online. The cost-sharing arrangement will vary depending upon the pharmacy and the plan selected. For example, the gold or the silver plan. Your out-of-pocket expenses will include monthly premiums, an annual deductible, and co-payments. Enrolling in Part D can potentially save the Medicare participant significant dollars, and the insurance helps cap out-of-pocket expenses. Note that delayed enrollment in Medicare Part D, for example, waiting till age 75 rather than 65, will result in a penalty, and that penalty continues each year in your premium payments. While Medicare is intended to restore a person's health and physical condition so that they can resume normal activities, long-term care refers to a range of services needed by individuals who are unable to perform basic activities of daily living, eating, bathing, dressing, continence, grooming, mobility, or exhibit permanent cognitive impairment, such as dementia, Alzheimer's, or Parkinson's disease. Unfortunately, the care will not restore normal health, but rather help the person's quality of life through that period of slow decline. The cost of long-term care, it's a wild card that can decimate the retirement portfolio. And that wild card is likely to appear. Statistics reveal that around 68% of adults over the age of 65 will be unable to perform two of those activities of daily living or exhibit cognitive issues sometimes during that retirement period. Long-term care insurance is specifically designed to indemnify medical care that's not typically covered by regular health insurance or Medicare. The covered services include or may include home care, respite care, which relieves the care burden shouldered by family members for some hours or maybe a couple days a week, assisted living, intermediate nursing care, and skilled nursing facility care. The long-term care insurance policy specifically identifies the covered services, the maximum daily amount, the duration of the coverage, and the cost-sharing arrangements. Out-of-pocket expenses include monthly premium payments, a waiting period before the benefits kick in. This serves the same purpose as a deductible, and coinsurance. The snag is that premium costs have skyrocketed as the number of insurance companies offering long-term care have declined. The loss of insurance companies is the result of insurers realizing just how long that slow decline can last. Longer longevity and fewer providers result in higher costs. In fact, I recall reading an article a few years ago that revealed long-term care premiums in New York increased by 40% in just 1 year. Many professional financial planners have shifted to recommending asset-based long-term care planning, including life insurance with a long-term care rider or an annuity with a long-term care rider. If the policy holder needs funds for their long-term care, then money can be withdrawn from the life policy or the annuity with no income tax consequence. If not, then the life policy and annuity remain intact for other uses. Preventative care. Ongoing preventative care needs to be a vital element of your overall plan for capping healthcare expenses during your retirement. When you stay current with annual checkups, with screenings, your healthcare provider might catch an ailment early, and that could lower your medical costs. Treating an ailment early could potentially avoid a trip to the emergency room or a stay in the hospital. Proper nutrition, exercise, and social engagement promote healthy aging and support mental sharpness. Preventative care is a smart way to help cap your out-of-pocket medical expenses and extend your life. Remember, many preventative care services are covered under Medicare Part D. In this video, you learn strategies that can help you manage and potentially cap the cost of healthcare during retirement, including opening a health savings account, selecting the right Medicare plan, adding a Medigap policy, enrolling in a Medicare prescription drug plan, planning for long-term care needs, and committing to a preventative care routine. Thank you for watching this Star and Standard Practical Knowledge video. I hope that the insights you've learned will motivate you to actively plan for healthcare costs during retirement. Remember, you can't afford to hold catastrophic risk because it could compromise your entire retirement income plan. I invite you to watch other videos that I've posted about retirement planning and other pieces of the personal financial planning puzzle. If you found the content useful, then please tap the like button, click on the bell for future notifications, and subscribe to the Star and Standard channel. Goodbye for now, and see you in a future video.